Welcome to another video. In this video, I will tell you what is giant cell or temporal arthritis. So let's discuss. Giant cell or temporal arthritis is an inflammation of the lining of the arteries. It involves large to small sized arteries and the inflammation is mostly granulomatous inflammation. Most often it affects the arteries in the head, especially those on the temples and therefore also known as temporal arthritis. Therefore it is also known as temporal arthritis. In case of aortic involvement, it is known as giant cell aortitis. What is the exact cause? The exact cause of giant cell arthritis is still unknown, but is thought that it can be developed due to immune system causing damage to body's own blood vessels. So, it is thought that there is an immune system disorder that causes body's own blood vessels damage. Polymyalgia rheumatica is an inflammatory disorder that is thought to be closely related to the giant cell arthritis and occurs in 40% to 60% of cases. Now we come to the clinical features. Clinical features of giant cell arthritis. Clinical features are severe head pain that persists and it is observed by the person on the temple area. Then scalp tenderness, jaw pain when you chew or open your mouth wide, fever, fatigue, unintended weight loss, vision loss or double vision, particularly in people who have also jaw pain. It should be remembered that temporal arthritis is seen above the 50 years of age in most of the cases and it is rare before 50 years of age. While in other arthritis, that is Takayasu arthritis, occurs in less than 50 years of age. So this is the main difference between giant cell or temporal arthritis and Takayasu arthritis, and you should remember this difference. Furthermore, palpitations can also occur in case of giant cell arthritis, and vision loss, I have told you, can occur in giant cell arthritis. Morphology. In case of morphology, we can see granulomatous inflammation of the double vessel wall of the blood vessel wall, and giant cells are seen in the granulomatous inflammation. Giant cells are also seen in the granulomatous inflammation. Furthermore, there is inflammatory infiltrate that consists of lymphocytes and macrophages. Lymphocytes and macrophages are also seen. Disruption and fragmentation of the internal elastic lamina is also observed. Disruption and fragmentation of internal elastic lamina. Proliferation of the intima or thickening of the intima occurs and occlusion of the blood vessel lumen occurs. Whenever there is proliferation of tunica intima, there is occlusion of the blood vessel lumen. Furthermore, tunica media thins or thinning of media occurs and scarring occurs and adventitial fibrosis, that is adventitial fibrosis also occurs. The healed stage reveals collagenous thickening of the vessel wall and the artery is transformed into a fibrous cord. The main treatment for giant cell arthritis consists of high doses of a corticosteroid drug such as prednisone. Because immediate treatment is necessary to prevent vision loss, the doctor is likely to start medication even before confirming the diagnosis with a biopsy. So, treatment consists of corticosteroid therapy or other suppressives, or anti-TNF therapies. Anti-TNF therapies are also effective for treatment of giant cell arthritis. This is all about giant cell arthritis.